Now, cannabidiol is obviously a marijuana derivative. We have pick here. Pregabalin, gabalin. We have done all of this. Okay. Now, in epilepsy in pregnancy. So, what happens is most important step in management is to control the seizure, obviously. So, in the previous one, we have done if it's a neural tube defect was there, no? For if we give valproate in pregnancy, there can be neural tube defects. So it's obviously not given in pregnancy. If female is already on the epileptic, same drug should be continued in pregnancy. So folic acid is added to prevent neural tube defect, obviously. Folic acid is added, particularly with valproate. Yes, if phenytoin is being taken, vitamin K should be given because phenytoin में क्या था Hormalica K for vitamin K deficiency. So during labor and to the baby also after delivery it's given. And regular ultrasound and other assessment should be done to know the fetal malformation. If female is planning to become pregnant, she should be stabilized on minimum number of anti-epileptic drugs. And newer anti-epileptic drugs are assumed to have lesser teratogenicity as compared to the older ones um, because because it is how it is. So valproate is the most teratogenic one. It's the most teratogenic one. क्या है ये? इसको हम कहीं और ले जा सकते हैं. Yes. Cool. So valproate is the most teratogenic, and however, the choice of drug depends primarily on the type of seizure. Because valproate तो anyway सबके लिए use करते हैं. But yeah, also it is for petite mal. And among the older drugs like carbamazepine, and it is assumed to be relatively safer. However, lamotrigine has a wider spectrum. Yes, and it's also preferred in pregnancy. Yes, and etopiramate can also be used in all of these except typical absence seizure. इसमें absence seizures में हम topiramate नहीं use करते. Lamotrigine obviously it has a broad spectrum, but it can cause like एसजीएस एंड टीएनएस टेंस कॉज कर सकते हैं और ये हम उसमें भी देते हैं डिप्रेसिव फेज होता लामोट्रिजीन लामोट्रिजीन देते हैं ना डिप्रेसिव फेज में भी देते हैं बट इट कैन कॉज क्या कर रहा था यार भूल गई यस 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 एसजीएस एंड टेंस it can cause adverse effect में and folic acid more 400 400 कितना हो गया माइक्रोग्राम्स 400 अगर माइक्रोग्राम्स है 1 2 3 हाँ 400 माइक्रोग्राम्स पता नहीं क्या लिखा है we don't need it we don't need it folic acid should be prescribed to all females of reproductive age who are on an anti-epileptic obviously if pregnancy is planned in high risk women मतलब previous child has neural tube defects then 4000 micrograms like 4 mg should be given daily and the beginning of first month before the time of planned conception. Now selection of the anti-epileptic drugs. GTCS is there and that means valproate, DOC. GTCS and DOC is valproate. सब में mostly valproate is the DOC. हाँ infantile spasm में ACTH is given. Alternate is vigabatrin but ACTH can also be given. Myoclonic obviously lamotrigine पढ़ा था. Can be given valproate. Absent में ethosuximide तो हमें पता है. If the baby is like less than 2 years of age है, तब हम ethosuximide prefer करते हैं. Anyway हम valproate दे सकते हैं. Valproate नहीं देते हैं anyway. Less than 2 years of age में because of the hepatotoxicity and also hepatic necrosis हो सकता है बच्चों में. फोकल में हम कार्बामेज़ेपिन देते हैं. लामोट्रिजिन GTCs में हम लामोट्रिजिन इज द ऑल्टरनेटिव. तो सब कुछ ही है ऑलमोस्ट. But phenidone is not the drug of choice. Valve GTCs के लिए valproate जैसे DOC सबके लिए valproate. Myclonic absent GTCs. Valproate is the drug of choice. For focal, it's carbamazepine, and for infantile spasm, it's ACTH. अब फेब्राइल के लिए डायज़ेपाम. फेब्राइल के तो हमें पता ही है कि हमने बेंजोडाइज़ेपिन देना था एनीवे. तो डायज़ेपाम. स्टेटस एपिलेप्टिकस के लिए लोराज़ेपाम इज द लेनॉक्स के स्टार्ट करें तो हम वैल्प्रोएट देते ही हैं. एंड इक्लैम्प्टिक सीजर के लिए हम मैग्नीशियम सल्फेट देते हैं. इसकी टॉक्सिसिटी हम कैसे चेक करते हैं? विद द नी जर्क से करते हैं हम check. In a patient with first episode of epilepsy, treatment can be discontinued after tapering the drug if patient is seizure free for 2 years. So the first episode of epilepsy आया and treatment is started, then we can एक तो हमें treatment taper करके करना होता है. Discontinued after tapering. So 2 years के बाद हम we can stop. Lennox-Gastaut syndrome. तो इसमें क्या है? इट्स डिफिकल्ट टू ट्रीट चाइल्डहुड ऑनसेट एपिलेप्सी दैट मोस्ट ऑफन अपीयर. एक और था ना ड्राविट सिंड्रोम which started in childhood. तो between 2 to 6 years में appear होता है. And it's characterized by frequent occurrence of different seizure types associated with developmental delay and psychological and behavioral problems also. So EEG actually, like what was it? Electrogram. अरे ईसीजी की स्पेलिंग ईसीजी का क्यों याद आ रहा है? ईईजी का क्यों याद नहीं आ रहा? ईईजी का क्या है? ई से क्या है? एंसेफेलो है क्या? ई एंसेफेलो इलेक्ट्रोएंसेफेलोग्राम. Okay. Shows characteristic slow pike wave and first line drug for treatment of raffinamide and valproate and benzodiazepine. एक मिनट गूगल से पूछ लेती हूँ. Okay Google, what is EEG? Electroencephalogram. Easy
Meaning
हो
of
गया.
easy. Achieved without great effort. Presenting few
Seriously.
difficulties.
What is the full form of EEG?
According to Mayo Clinic, EEG brain
Electroencephalogram.
activity.
Okay. भैया ठीक है. Shows characteristic. First line of drug for treatment is raffinamide. Valproate is the drug of choice, no? First line drug, valproate and benzodiazepine. For pulse seizure also benzodiazepine. Clonazepam and clobazam. Second line of drug is देखो valproate दिया, raffinamide दिया and clobazam दिया है. This is benzodiazepine. Now felbamate and topiramate. Felbamate and topiramate. This is the second line of drugs. ये हो गया अपना एंटी एपिलेप्सी. काफ़ी ज़्यादा तो है वैसे, काफ़ी कुछ लर्न करने को है इसमें. इट्स काइंड ऑफ कंफ्यूजिंग बिकॉज बहुत सारे. दिस इज द मोस्ट इम्पॉर्टेंट ऑब्वियसली, दिस टेबल. किसमें क्या ड्रग देते हैं and all that. And this diagram is also important कि कौन सा ड्रग कहाँ पे एक्ट करता है. बाकी it's a lot of information. Tardive dyskinesia. um, इंफॉर्मेशन है बट काइनेट देखा मैंने बोला था यहाँ पे मैंने पढ़ा है कहीं पे तो काइनेट it's a decrease in the neurotransmitters so this is one of the receptors kainate receptors और यहाँ पे भी था यहाँ पे acting on a kainate receptor तो ये रहा topiramate was acting on the kainate receptor